Patients often ask me one question: why does this hole keeps draining? They have taken antibiotics, they've had it drained, they have waited months, sometimes years, and it never heals. Today I wanted to explain what the anal fistula actually is and why the body creates it and why it cannot heal on its own. So people are told it's just a small tunnel, or it just needs some time. If that were true, I would already be healed. So what an anal fistula actually is? An anal fistula is an abnormal tunnel connecting the anal canal to the skin. But that's not the disease, that's the result. This is the real disease. The real problem is a persistently infected anal gland. So this is the sequences. Anal gland becomes blocked. Abscess forms. Abscess drains. Infection remains. The fistula is simply the drainage pathway. But why the body creates the tunnel? This is critical. The body learned something. When the abscess closed, pressure built, pain exploded, infection spread, so the body adapted. The fistula exists to prevent another abscess. It's not failure, it's protection. So why it never heals? Because healing requires clean tissue, no infection, blood flow. If fistula has an ongoing stool contamination, chronic inflammation, epithelium develop inside of that canal, the tunnel becomes skin. Skin does not heal inward. That's why waiting never works. So why antibiotic fail? Antibiotic cannot close the internal opening, remove the epithelial lining, stop fecal contamination. They may reduce swelling, but cannot cure the disease. Why drainage is not a cure? Drainage treats the pressure, not the source. That's why relief is temporary. So let's talk about simple versus complex fistula. This is very important. For the simple, low tract close to the anus, minimal sphincter involvement, high cure rate after treatment. For the complex, cross sphincter muscles, multiple branches, horseshoe extension. Anatomy determines treatment, not size. Why surgeons don't just cut it open? Because sphincter muscle control continence. Every surgery balances cure versus continence. That's why they are different procedure. Fistulotomy, setting, lift, flap, no confusion, precision. One special scenario I need to talk about it is Crohn's disease, and we have some red flag here. Multiple openings, recurrence despite surgery, anterior fistula in women, diarrhea or weight loss, because Crohn's fistula behave differently and require medical treatment. So MRI or CT we should order. The CT shows infection, MRI shows the pathway. Fistula disease is about map, not blob. So missing branches can give you some recurrent disease. Do not forget this: an anal fistula is not a wound that failed to heal, it's a tunnel the body creates to survive. So what happens if it's ignored? Recurrent abscesses, expanding tracts, more muscle involvement, harder surgery later, delay never simplify fistula disease. And I will close with this. The drainage you see is not failure, it's the body protecting you from another abscess. Healing begins only when the source is determined. This is Dr. Ben Mamer follow to build momentum to fix healthcare in America.